Welcome, good morning ladies and gentlemen. I'm Heinrich Mattle, a neurologist from Bern in Switzerland, and here is Whitley from Edinburgh in Scotland, together with Dr. Elvind Berge from Oslo in Norway. They have presented yesterday additional data at the ESOC conference, a second European stroke conference in Barcelona, about the International Stroke Trial 3. And my first question to Whitley is, what is the International Stroke Trial 3?
So the third International Stroke Trial was a study of 3,035 patients who were randomized to either alteplase plus normal treatment versus normal treatment, and really addressed the question, what are the age limits of alteplase treatment? What are the severity limits of alteplase treatment? How should we treat our patients in whom we were substantially uncertain whether thrombolysis was indicated or not?
And what were the main findings then of this third international stroke trial, Dr. Berge?
The main finding was that alteplase given within 6 hours was effective in improving functional outcome at 6 months for a variety of patients, including both the elderly patients over 80 as well as patients with very severe strokes, etc.
And these were the main findings. Now you have made additional data analysis of this large data set. What analysis have you done now and presented yesterday?
So yesterday what we were interested in was what is the very long-term mortality of patients treated with alteplase. And we did that by linking participants in the IST3 trial to electronic health records in Norway, Sweden and the United Kingdom. This is a new research method which I think is very important for many researchers to know about, because it allows one to determine long-term effects of treatment very cheaply.
Has IV alteplase an effect on mortality or just on functional outcome, Dr. Berge?
Well, our analyses, which we presented yesterday, showed that alteplase has a clear trend towards survival benefit in those patients. So we found a non-significant difference in survival in favor of those treated with alteplase within 6 hours of stroke.
And is this survival benefit visible at all stages after the stroke and treatment?
Well, the benefit was apparent after 6 months in reality. There was an increased mortality within the first week of treatment, but after that there was this increase was offset by a later benefit in survival. So from 6 and 18 months onwards there was a clear separation of the survival curves, and after 3 years there was a 3.6% absolute reduction in deaths among patients given alteplase in the acute phase.
That's an excellent result. 3.6% less disabled patient. That means 36 patients per 1,000 treated less disabled, and perhaps less in nursing home. In addition to decreased suffering for the patient and families, Dr. Whitley, does this also have an economic impact for the society? Have you looked at that?
So one thing, that's 36 fewer people who've died rather than necessarily less disabled. Will it have an impact on health economics? Well, these are analyses that are underway at the moment. Again, in the countries where it's possible to link to routine health care data to make estimates of healthcare resource use in the very long term. So these analyses are underway, and hopefully we'll be able to present them at an ESOC in the future.
Dr. Berge, you said in the first days there's an increased mortality which is offset by better survival later. Is there a special patient group that is at special risk of dying when you give alteplase?
Yeah, we know from before that elderly patients and patients with severe strokes are at higher risk of intracranial hemorrhage and death in the acute phase.
And are these patients patients today better treated with endovascular therapy, or do you still think we should give IV alteplase to them?
I think we still should give alteplase to them, because on a longer term, these patients these patients benefit as much as younger patients and as much as patients with milder strokes.
And should we give the full dose of alteplase, or should we give only 2/3 of the dose?
Well, that's an early question after the presentation of the Enchanted results yesterday. But there are reasons to consider giving a lower dose to those patients. I agree.
Okay, I thank you both very much for presenting this additional data analysis, and I hope many more data will come forth from this huge data set of IST3 that has really made a change in the treatment of stroke. Thank you, ladies and gentlemen.